Hi, are you a parent of a child who struggles to finish their basketball or soccer game because of a painful heel that has them hobble off the court? Or if they do get through the game, when you get them home and they step out of the car, getting them into the house can be a real struggle and a real challenge because of the pain they've got in their heel. Or are you a health professional, a physio or a podiatrist who's struggling to resolve a stubborn case of Calcaneal Apophysitis or Sever's disease? If so, this might be a video that you want to stick around and watch. My name is Andrea Costello and I'm the Director and Senior Podiatrist here at AC Podiatry. Today, what I want to speak about is heel pain in kids. Traditionally, it's known as Sever's disease, although we talk a lot about it being now Calcaneal Apophysitis. The reason I want to speak to you about it is because traditionally, this has been a problem that's been managed as what we call a tractional apophysitis. What does that mean? It means that many people believe that as a child grows, the pull of the muscles at the back of the leg or even under the arch put a traction or a force through the heel, which aggravates or flares up the growth plate. And with the flare up of that growth plate in a child, we have this pain and discomfort. And as an example, just to show you this picture, this is what we're looking at here, this growth plate in kids, okay, where you can see the heel, the bone hasn't fully developed. So traditionally, most of us practitioners, podiatrists, physiotherapists have instituted a care plan or a treatment plan involving changes in shoes to higher drop and softer heels, maybe some rest, stopping the kid from playing some activity, use of heel raisers inside the shoes to lift the heel up, or maybe even some tapes and massage of the muscles to help them release. Now, whilst all of these are tried and true forms of treating Calcaneal Apophysitis or Sever's disease, in a lot of instances, they can't or aren't overly successful. Or even if they are, once that treatment is removed, and that can include orthotic therapy, once it's removed, the pain returns quite quickly. Now, I'm going to explain why that is the case and why the solution that we have may be the answer to your problems. So if we come back and think about that tractional apophysitis, the idea has always been that if you remove the pull or the tension from the tendon, that will cause a release of pressure on the heel. But what if I was to tell you that it's not actually the traction of the Achilles that's causing the problem, and rather it's the jamming or the compression of the growth plate of that heel into the ground that causes the problem? We see this problem, Calcaneal Apophysitis, Sever's disease, in those children that are playing soccer on hard surfaces in pre-season. We see it in children playing basketball or netball. The common thing that a lot of these sports have is the hard surface of which they're playing against. And if you repetitively hit the heel into the ground, you can get this change or discomfort in the bone, understanding that in children, bone is much softer than it is in adults. There's been a lot of studies looking into Calcaneal Apophysitis, and what we found is that for the most part, nobody can really tell you what's going on. So we've deduced and used our clinical diagnosis and clinical reasoning skills to say, yes, it's a tractional apophysitis and that it's pulled. But some early work, and even anecdotally what we're seeing here in the clinic, is that if you send these children for MRIs and you have a look at their heels, what you're actually seeing is an increase in what we call edema or swelling on the bone. And that is an indication that what we're actually seeing here is an increase in pressure or jamming of the heel. And that is likely the cause of the heel pain in kids. Now, I'm the first one to admit, and I've got videos of them, where I've treated kids with heel raisers, with tapes, with orthosis, with stretching exercises. And they do work, but I don't believe they work for the reasons that everybody tells us they do. Okay? My view is that by stretching, by using an orthotic, what you're actually doing is that changing some of the compressive forces caused by the muscles around the heel, like the Achilles and the fascia on the bottom called the plantar fascia, to reduce the compression up into the heel. What I want to propose is a different way of thinking, a movement away from the heel raisers, a movement away from the orthoses, which again have worked in some instances but don't always work in other cases, and when they're removed, we get a resumption of the symptoms right back to where they are. And so how do I propose, or what am I talking about? Well, what I'm talking about and what I'm suggesting is a new way, or a new way of thinking about it is a new intervention, okay? A new way of offloading the heels. Remember, traditionally we spoke about using a heel raise. Well, there was a great study done back in 2006 that showed that if you put a heel raise under a heel, any heel, you're actually going to increase the pressure under the heel by as much as 44 or 45%. So you can imagine that if you have a kid that's got a painful heel, because the force is going into this growth plate here, and we put a heel raise underneath, we may actually be increasing the peak plantar pressures into that heel and making things worse. Now, that same study said that if you put someone in an orthotic and you add some arch support, you will actually reduce the pressure on the heel by as much as 50%. So this is why orthotic therapy has been so good, if you like, at managing heel pain and calcaneal apophysitis in kids. But what if I was to tell you there's a way of reducing peak plantar pressures by even more? By almost completely offloading the heel to the point that there is no direct pressure being placed in the heel. Okay? Well, that's what I'm here to talk about today. And the item I'm talking about is this little thing here called a Solemaids. All right? Now, we're fortunate enough here at AC Podiatry to be the only distributor of this item here in South Australia. And why? Why have we made this decision to kind of with a service centre in Melbourne and to actually help them get the message out and to distribute this item? The reason is because of the way that it works, okay? This particular item, this particular appliance removes the pressure on the heel, okay? If we come back to looking at this view here, we can see that by positioning this Solemaids under the heel, what we're actually and effectively doing is elevating the growth plate off the ground. We spoke about a 44% increase in peak plantar pressures with a heel raise. We spoke about a 50% reduction in peak plantar pressures with a standard custom orthotic. With something like this, we're reducing the peak plantar pressures on the heel by as much as 90%. Anecdotally, we are seeing as much as a 90% resolution or reduction in symptoms in children in as little as 3 weeks' time. And this is without a change in activity. This is without a change in their loading patterns. So what we're saying is if we can put this in a kid's shoe, they don't have to stop the activity they're doing. They can continue to do it. And it's really quite interesting watching in clinic where you'll get a child who rocks back on their heels to test it, and they're actually quite painful. And you put this in their shoe and you get them to do the same thing, and we see a reduction in pain almost instantly. And I had a young fella in last week who, for 6 months, hasn't been able to do a full training session at footy. A 9-year-old kid who hasn't been able to do a full training session at football, just does the skills, can't run. Came in, rocked back on his heels, painful, couldn't tolerate it. We measured him up for one of these, we put them inside his shoes, he rocked back, complete resolution. And I'm saying to you, he had no pain in his heel when he rocked back in. Now, we'll obviously be reviewing him in 3 weeks' time, but that's a phenomenal start. And this is a kid who has tried the orthotics, the stretching, the heel raises, all of those traditional treatments, of which there is nothing wrong with, okay? But every now and then you're going to need a child who's going to need a little bit more. Someone who's going to have that bony edema, that aggravation where the problem's been around for a while. And how do you best offload the heel in such a way that you're going to get this fixed? The Solemaids is it. It's a game changer. And I've been in podiatry for a long time, 25 years. I don't nerd out or geek out about much anymore. But this, for me, is going to be a game changer for calcaneal apophysitis, and already is. Anecdotally, in conversations we've had with people like the Service Centre in Melbourne who have issued hundreds of these, the results have been stunning. So to finish up, I'm here saying to you, there's nothing wrong with what's been done before. Absolutely nothing wrong at all. And with all the evidence that's been put to us as clinicians and to you as patients who have clinicians telling you there is nothing being wrong with the treatment that's been provided to you to this point. But if you are someone who's got a kid who just can't get better, you've got a child who is not doing the activity they want to do, that we've been told they have to rest, that you've tried everything and you still can't get the problem sorted, it may just be that this is the missing piece, that this Solemaid may be the bit that gets your kid back to doing the activity they want to love. And to you clinicians out there who have struggled, you've tried everything. You've done the needling, you've done your mobbing, you've done your orthotics, you've done the footwear changes, you've done the rest. You've done everything that we've always done as clinicians, and in most part have had those fantastic results. But you've got those stubborn cases, those cases that won't settle. Refer them on, send them through. We'll put them into one of these Solemaids and we'll get them cracking along and help you out. We won't take away from what you're doing, because what you're doing is great work and nobody's suggesting it's not, okay? But what this is a game changer in reducing those peak plantar pressures and addressing I think, the missing piece. And this is not just me, this is a lot of other people who think the missing piece in managing calcaneal apophysitis in kids. All right. So again, if this speaks to you or speaks to someone you might know about, please share the video with them. If you've got any queries or questions, don't hesitate to reach out and let me know. I'm happy to help in any way, shape or form. Happy to discuss this further for anybody that wants to know. We're like anything, we're here for you, always and every day. And I'm here in any way that you need me to be. All right. So with that, I'm going to keep moving and get back to my patient list. But, think about it, share it, tag people in. Anything we can do to help kids with heel pain, we're here to help. All right. And go well. Ciao, ciao.